Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about a surgical instrument called Hegar's Cervical Dilator. So go ahead, subscribe, and let's get started. Dear students, we will see about Hegar's Cervical Dilator. These are smooth, cylindrical, double-ended metal instruments used in gynecological procedures to gradually dilate or open the cervix. They are designed in a way that makes insertion gentle and safe. These dilators come in a set of increasing sizes, and they are used step by step, starting from the smaller size and moving to larger ones. This gradual process helps to avoid injury or trauma to the cervical tissues and ensures safe and effective dilation during procedures. We will now look at the description of Hegar's Cervical Dilator. This instrument is made of stainless steel, which makes it strong, durable, and easy to sterilize. It is double-ended, meaning each instrument has two ends with different sizes or diameters, so it can be used for gradual dilation. The sizes usually range from very small, around 1 millimeter, up to larger sizes of about 18 to 20 millimeters, allowing step-by-step use. The instrument may be slightly curved or straight, and it has blunt, rounded tips to reduce the risk of injury while inserting. It is commonly used in both gynecological and obstetric procedures where gentle cervical dilation is required. Dear students, we will now see the parts of Hegar's Cervical Dilator. This instrument mainly has two dilating ends, and each end has a different diameter, which helps in gradual and step-by-step dilation of the cervix. In the center, there is a shaft or handle, which is the middle portion used for holding the instrument, and it is usually slightly thicker to provide a better grip during use. The ends are rounded and blunt, which helps to minimize injury or trauma to the cervical tissues while performing the procedure. We will now see the uses of Hegar's Cervical Dilator. This instrument is mainly used for cervical dilatation before performing various gynecological procedures. It helps in gently opening the cervix so that other instruments can be safely introduced. It is commonly used in procedures like dilation and curettage, medical termination of pregnancy, and insertion of intrauterine devices. It is also used during hysteroscopy to allow better access to the uterus. In some cases, it helps in managing cervical stenosis, which means narrowing of the cervix, and it is also used for evacuation of retained products of conception. Next, we will see the nurse's responsibilities before the procedure when using Hegar's Cervical Dilator. The nurse should first prepare a sterile set of dilators and arrange them in the correct order of sizes so they can be used step by step. It is important to check the instruments for any damage such as bends, rust, or defects to ensure patient safety. The nurse should assist in positioning the patient properly, usually in the lithotomy position, for easy access during the procedure. Informed consent must be confirmed before starting, and strict aseptic technique should be maintained to prevent infection. The nurse should also provide psychological support to the patient and clearly explain the procedure to reduce anxiety and promote cooperation. We will now see the nurse's responsibilities during the procedure. The nurse should assist the doctor by handing over the dilators in the correct increasing size order to ensure gradual and safe dilation. At the same time, the nurse must continuously monitor the patient's vital signs to ensure the patient remains stable. It is also important to observe the patient for any signs of pain, bleeding, or vasovagal reactions such as dizziness or fainting. Throughout the procedure, the nurse must maintain a strict sterile field to prevent any risk of infection. Dear students, we will now see the nurse's responsibilities after the procedure. The nurse should closely monitor the patient for any complications such as excessive bleeding, signs of infection, or in rare cases, uterine perforation. It is important to observe the patient's condition continuously to ensure early detection of any problems. The nurse should also provide proper perineal care to maintain hygiene and comfort. Finally, all details of the procedure and the patient's response should be carefully documented for accurate record keeping and further management. We will now look at some key points to remember while using Hegar's cervical dilator. Dilation should always be done gradually and gently to avoid any injury to the cervix. Using the wrong size or applying force can lead to complications like cervical tear or even uterine perforation, which can be serious. It is also very important to maintain proper aseptic technique throughout the procedure to prevent infection and ensure patient safety. That brings us to the end of this video. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.